Hi, my name is Rabiya Hasan, and I'm a child and adolescent psychiatrist at Atrium Health. I have been asked to provide some information on autism spectrum disorders. Autism spectrum disorders affect 1 in 54 children. And autism spectrum disorders are neurodevelopmental disorders that affect social communication, social interactions, and can often cause repetitive and restricted patterns of interest and behaviors. There's not one type of autism. There are many different subtypes of autism, and each individual has a distinct set of challenges and a distinct set of strengths. There's a wide variety in the impact that autism spectrum disorder can have on an individual's daily functioning. Some individuals have significant impairment in their daily functioning, others have less, and others can function independently. The cause of autism spectrum disorder is likely multifactorial and involves genetics, biology, and environment. So some things that we know some things that we do know are associated with autism spectrum disorder are having a sibling who has been diagnosed with autism spectrum disorder. Children of older parents are at higher risk of developing autism spectrum disorder. There are certain viruses and medications during pregnancy that can increase the risk. There are certain genetic conditions that carry a higher risk of autism spectrum disorder. But one thing that we do know is that vaccines are not associated with the development of autism spectrum disorder. This was a widely held belief in the past, but significant research and studies have been done, and they have shown that there's no association with vaccines and development of autism spectrum disorder. So what are some of the signs and symptoms of autism spectrum disorder? In babies and toddlers, things to look for would be a baby not babbling, not responding to his or her own name, or not pointing out objects to show interest and share interest with others. It's important to be aware of what are the normal developmental milestones for a child, because a delay in the developmental milestones, such as a delay in the acquisition of language, can be an early sign of the development of autism spectrum disorder. Other things as individuals get older could be not wanting to seek out friendships, wanting to engage in more solitary and isolative behaviors, or wanting to seek out friendships but having difficulty in knowing how to relate, play, or communicate with others. So another question that is commonly asked is, how is autism spectrum disorder diagnosed? There's no specific medical test that can diagnose autism spectrum disorder. Rather, it is a clinical diagnosis. And the American Academy of Pediatrics does recommend that screening is performed for every child at well child checks for autism spectrum disorder at 18 months and 24 months, or any additional time if there's any concerning behaviors or if an individual is at higher risk, such as if they have a sibling who has autism spectrum disorder. So the brief screening does not necessarily provide the diagnosis. A diagnosis can be made as early as 18 months, sometimes at 2 years, but sometimes in situations where individuals have less severe symptoms, it may not be diagnosed until they are much older. So if there are concerns, a formal developmental evaluation may be needed, and this will be done by a trained professional. And this involves a more in-depth look at the child's overall development. So this will involve observation of the child, structured testing of the child, and likely structured testing of the parent or caregiver, where they'll be asked specific questions about the child's overall development, communication, and interaction style. So it's also important to remember, even without a formal diagnosis, early intervention services are important. So if there are any concerns about delays in achieving developmental milestones, there are early intervention services that can take place from birth to 36 months, and this can involve occupational therapy as well as speech therapy. Now, once a formal diagnosis of autism is made, there is not any one specific treatment. There are different types of treatment, and it's important to have an overall comprehensive treatment plan. There's no medication that treats the core symptoms of autism spectrum disorder, but comorbid diagnoses such as depression, anxiety, and ADHD can be treated with appropriate medications. In addition, there can be aggression and irritability associated with autism spectrum disorder, and there are FDA-approved medications to treat these symptoms. There are different types of therapies that have been shown to be helpful, including social skills groups. This would involve having similar aged peers and working together to understand how to respond to social cues and how to initiate spontaneous conversations with peers. One type of therapy that has been shown to be particularly helpful is applied behavior analysis. Now, this is a type of therapy that applies how behaviors work in real situations. And the goal of ABA is to increase positive behaviors and decrease behaviors that are problematic or harmful to learning or social development. And this involves a therapist coming to the individual's home, and this has been shown to increase language and communication skills, as well as decrease problem behaviors and increase attention, focus, social skills, and academic skills. So here at Atrium Health, we work in conjunction with our community providers to develop a comprehensive treatment plan for an individual with autism spectrum disorder. We have psychologists that can perform formal testing for autism spectrum disorder. We have psychiatrists who can provide medication management for the different comorbid disorders and symptoms that may occur with autism spectrum disorder. And we also have speech therapy and occupational therapy services. We have community providers that can provide ABA therapy as well. So this is just a brief discussion of some of what we can offer for treatment and diagnosis of autism spectrum disorder. Thank you for your time.